when someone presents with problems of attention deficit hyperactivity disorder, there's a strong likelihood that what's really going on is a brain-based condition. And in many cases, those individuals don't come to a physician or a clinician until they're adults, sometimes because their children have been diagnosed, other times because they've finally found out about it and realized that this helps to explain the pattern of difficulties they've had earlier in their lives. And in fact, the treatment importantly begins with education. Probably the most important aspect of treating ADHD in adults is helping them to better know themselves and to understand both the strengths and the weaknesses of who they are, and frequently just that awareness brings with it much relief and a sense of understanding. At the same time, it can also be quite healing in the sense of realizing that these are part of one's biology and a challenge to be overcome, but still something that is, at least in part, not entirely one's fault. So beginning with that support for learning about oneself, then it's important to look at how the person has compensated, what their strengths are, and to build on those, as well as to examine honestly what the areas of weakness and vulnerability and problems are. Again, someone's not going to come to a clinician if their life is working very well, and if ADHD is not an issue. It's likely because they're having serious problems. Often those problems are quite complex and deeply rooted. But by thinking through and working methodically, it's possible to start prioritizing these and focusing on them and seeing what the resources are that are available. As part of that process, it's important to consider the potential usefulness of medication. Medications can have dramatic effects at first, but those are rarely sustained at that level. Some effects are usually present for long periods of time, but it's important to caution patients that that very first dose may be a unique experience, and that they should not expect to have that sort of dramatic effect on a regular basis. In fact, that's one of the ways in which stimulants can sometimes cause problems, is if patients seek to try and recapture that initial amazing effect. It doesn't happen, and they'll try and increase the dose, and doing so, again, only very temporarily enhances that effect, and then they're at a higher dose, etc., and so that can be quite a problem. Many patients can take stimulants on a regular dose for years and years. It's important to monitor cardiovascular parameters, blood pressure, pulse, sometimes electrocardiograms. And there also are non-stimulants that also need to be thought about in terms of risks and benefits. But the stimulants in general are the most effective in the short range and really quite safe overall. But there are individuals who do become dependent or addicted, and certainly there are a few who are quite sensitive to some of the side effects, whether they be cardiovascular or other psychiatric effects, including, in some cases, hallucinations or delusions. Again, those are rare, but they do exist, and it's important to be aware of that. So, again, the final thing I would say is that we know that ADHD is a biological condition. It's deeply rooted in who we are in terms of our brains. And so this is a chronic situation. It's not something that's cured easily or rapidly, but it needs to be thought about as a chronic care condition. And so this is a partnership for the long haul, and it's important to take one's time, be thoughtful, and to think about how to create and craft a treatment plan that will deal with all of the challenges of life in a collaborative way. And I think that's all I have to say today, and thank you for being part of this process.